Good evening, everyone. I'd like to welcome you to Wednesday, December the 9th, a special meeting of the Warren County School Board. All right. Accept or modify the agenda. Anybody want to change anything or add anything?
Mr. Chairman, I would move that we accept the agenda as presented.
Second.
All those in favor?
Aye.
Opposed? Hearing none, motion carries. Action agenda is health insurance. Dr. Ballinger and Mr. Smith, please.
Thank you, Mr. Chair. So tonight we're here to discuss our two options as far as with with the possibility of moving from local choice to Aetna or staying with local choice. And tonight you'll hear bits and pieces from myself, Mr. Smith, Ed White, and then Jim DeBrewer from Creekside is here to also assist with any questions that the board may have concerning our, the insurance plans. So I'm going to start off with our medical rate comparison sheet. That's the big rate sheet that's in front of us. So what we did, we removed United because there was, across the board, the services were apples to apples, and we did not see the savings that we would see with Aetna, so we just removed United Health from there. If you go down from line to line, you're going to see that it's the exact same policy moving from one provider to the next. The only difference, and it's actually a benefit to our employees, would be the vision. And that vision line, you can see that as far as with the co-pays and the allowances, that Aetna actually will have a better service than the current vision plan. So that's really the only difference, and it's actually a positive looking at going from Anthem to Aetna. I want to move on down to towards the bottom there where we have single, dual, family, and really look at the monthly liabilities. And so here, if you remember when we first had this meeting, you had the three sheets. This sheet, one with vision, one with dental. Well, we put all of those rates together, so now we can look at all those rates without having to change sheets and add them all up. And when you look at the rates and compare the Key Advantage 250 to the Health Network only 250, you can see the differences between the two providers. Now, I do want to make note that there's actually one category that Aetna, there would be an increase, and that is in the 1,000 dual, and that is a little bit higher than what Anthem would have by approximately $10.97. But all of the other categories, there's a lot of reduction. And so when we look at the benefits and the rates, so I want to talk about right now to get through this plan year, the next 8 months. So when you look at going from, or look at what Anthem cost would be, we know that there's a monthly liability for Anthem of $524,287, and over the next 8 months, that's going to bring that total to $4,194,296. When you compare that with the rates that Aetna would provide, again, your monthly liability of $460,772.71, which that total over an 8-month period would be $3,686,181.68. So when you look at the differences over the next 8 months, because we want to get through the next 8 months, and although this is a 20-month plan from Aetna, we want to look at the next 8 months to see where we would be at and then how we could roll all that into next year. So just within the next 8 months, you would be looking at an approximately $508,114.32 in savings. Now, with that said, there's two things we have to keep in mind. One, we have to keep in mind the adverse experience which Mr. Smith and Mr. White have mentioned about that, Anthem can go back, look back and give us a bill for services or fees or whatever there may have been that we need to cover. Plus, in moving from one plan to the next, to make sure that our employees do not see an increase in their premium that they're paying per month. There will be a slight cost to the school division to make sure we hold everybody harmless. So for instance, like this one category where it would jump it up $10, we're not going to push that off to the employee. We're going to cover that. And Mr. Smith's going to dive into this a little bit later, but if you look at the second sheet that I have here, it's this sheet right here. And if you look at the bottom of that sheet, you see that moving total of $85,640. So that $85,640 would be the total that we would have to put forth from the division out of what we would save from moving from Anthem to Aetna, and take that from that reduction or from that savings, which would bring us down to around $422,474. So that way we hold everybody harmless. Some people are going to actually see probably a reduction in their premium, not a lot, but a slight, while others wouldn't see a reduction in their premium, but they're going to see a health benefit by getting a better vision policy than what they currently are on. So, we wanted to make sure that everybody is held harmless, that we make sure we still provide what they were used to as far as providing the health insurance coverage that they're expecting, and to make sure that we do our part in filling those gaps where we need to fill those gaps. So again, I mentioned we have to look at that adverse experience. So whatever that cost could be would then have to come out of that $422,000. So if it's $0, you keep, we would still have that $422 that we could roll into the next plan year and try to reduce our insurance costs. Or if it's $100,000, then you would be looking at a $322 that you could roll into. We just don't know what that number will be, but we have that dollar amount looking at us right there. Now that's just for the next 8 months. So then you look at what we would get the following year. You're looking at $947,000, taking us to the next year that we could roll into our plan. Now our goal would be to look at which direction the board wants us to go. If we stay with Anthem, we stay with Anthem. If we move with Aetna, it puts us in a place to where we kind of get to be in the driver's seat for once, to where we can kind of control what we want to do with our health plan and how we can provide things for our employees. And so that would allow us to reinvest, to help market ourselves in a better light when it comes to benefits and various things like that. So when you look at also our employees have experienced on that same sheet that has the $85,640 on it, if you look at the years from 18, 19, 19, 20, 20, 21, you can see that our employees have experienced that reduction for the past 3 years. So that means for Warren County, we've been doing a great job and we have a good rapport so that our premiums are going down, they're going lower. So this would also just put us in a place to continue that trend and to really benefit our employees moving forward. Again, it also is an opportunity to just reimagine what we could do with our plans. Right now we currently have 3 plans. This would give us the opportunity to maybe move that down to 2 plans, to where it would make it more manageable, because a lot of times as employees, you go in and you're meeting with that benefits coordinator and they're throwing all this stuff out to you, and you're missing half of it because you just don't know, because there's so much information out there. And so we would like to, take an opportunity, if we make that move, it would give us the opportunity to really look at being able to possibly reduce the number of plans that we have that would benefit our employees on down the road. So as we look at this, Mr. Smith's going to come up and he's going to talk to you about our current premiums or employee contributions, and then he's going to talk to you about a proposed employee monthly contribution if we make a move to Aetna, and what that may look like for the next 8 months.
Thank you, Dr. Ballinger. The first sheet I'm going to be referring to are our current Anthem rates that we have. I know at the top it says proposed. This is the one that has like the two little, one's kind of a grayish and one's kind of a greenish golden area there. Let's just focus on that sheet for now. I just want to bring forward to you the current rates that we have. So currently we have our plan. We currently have our plan with Anthem, and in that plan we have to offer, according to their program, we have to offer two of each plan, and one is a comprehensive dental and one is a preventative dental. And the definition of that is really exactly the name itself. The plan that's the preventative is a little bit cheaper, and that's what is less expensive. And that's what it does cover dental-wise, is preventative measures and those type of things. The comprehensive is just that. It's more comprehensive coverage at the dental office. And you'll see that we have the 250, the 100 or 1,000, and the HSA. Going to a second sheet that you're going to have, which is going to be a proposed rate sheet, and that has that gray area. And if you just kind of put those side by side, just so side by side, so we can kind of see both of them together. What we want to do is we want to be able, as we mentioned before, to provide a plan that meets that's no additional cost for our employees at this time, and so that we can either have some reduction, and then in the future, as Dr. Ballinger said, to invest some of those savings back into the program. So the Aetna dental plan is that would be compared to the comprehensive dental. So we wouldn't have that preventative dental itself. So if in our theory that we want to make sure that we're not increasing the rates, we would move the preventative dental column, those rates, and implant them where it would currently be the comprehensive dental. And that's what the sheet that you have beside your sheet that just has one shaded box on it, that's what that does. So that's where we came up with the rates. Now you may say, well, let's talk a little bit about the advantages of that. If we were to move everyone over to the comprehensive dental rates, then the people who would be coming from the preventative side would have an increase in their rates. If you just look at the top row of the current rates, the employee only, with Anthem, it's $157 for an employee only. That's in that gray column that's down through there. Now, if people were to come over from the preventative over to that, they would experience an increase of $4 per month, and that's minimum. But however, that's not our purpose to do that. So in some other areas, it gets to be considerably more that it would cost the person each month. So in order to hold everyone harmless, we move those rates over to the one sheet that you have here, the gray the gray sheet. And the advantages of that would be the people in the preventative, yes, would pay the same amount currently and in this plan for the next 8 months, but they're going to get an increased dental plan with part of that. So that's the trade-off there. As far as the ones who are currently in the comprehensive plan, they're going to remain in that plan, but they will, and their trade-off is going to be they will see a slight reduction in their premiums. So you're moving over to a better plan. You're bringing those rates with you, so there's no increase to that. And then at the same time, those who are already in that plan, they're going to get the same health benefit, but they'll end up getting the amount that everyone will pay this amount. But I'm just using it as an example of that's where it's coming from. It's coming from the preventative side over into the comprehensive side. So it's sort of a win-win with that. There's no increase. Some of the, as Dr. Ballinger mentioned earlier, and we talked about last time, some of the benefits within the plan itself are stronger with Aetna. So that's what we came up with, our rates. That's what we would to use that. I also noted on here that these rates are good for the remainder of this plan year. We're an October 1st plan year. Some people are July 1st, October 1st. We're an October 1st plan year. We normally start doing open enrollment in August for our plan. You'll notice on that the new rate or the proposed rates for Aetna that I've taken from the large sheet, and you don't have to pull these out, but just visually be able to see it, where Dr. Ballinger had went over earlier in regards to what is the full premium from Aetna, and that full premium includes dental, vision, and health. And then I put those into the new rates, which would be the total premium, and then setting the rates as they are from the preventative dental category, add in what is the contribution of Warren County Public Schools currently for that plan. So that was our thought and philosophy behind how we came up with the rate sheets and what the rates would be. Any questions on that part before I move into I want to move into some other stuff, but I don't want to jump too far ahead.
I do have a question, Mr. Smith, and I can't figure out what I'm missing. But if you look at either one of the sheets that you've given us, one Anthem and one Aetna, it says dual employee and spouse and dual family. On the Anthem side, it says total premium is all zeros. Why? Do they not offer that, or do we not offer that?
Well, they do offer that.
Okay.
It's kind of us sort of offers that.
Okay.
We offer that as a benefit to our employees who have a spouse that works within the system. What that would end up being is, why it's not in there, I can tell you what is supposed to be in there and how it works.
Okay.
Okay, the dual employee and spouse. So we're working off of an employee and spouse premium. Okay. So if we look at the sheet that I'm referring to,
Yes.
if we look at the employee and spouse premium for that, it would be
1464 on the Anthem side.
okay. We can use 1464. Okay, so that would be the premium cost for that plan. Now, as an individual, you're given the contribution. So a contribution for that is $826. Okay, so we start at $14.64, That's going to go where that zero's at.
Yes, sir.
And then the 826 would be the contribution that you would get if your spouse did not work within the school system, okay? Then what you do, because the person does work in the school system, the contribution that that person would receive then is applied to this plan, to that line item. So, from 638 would be, 638 would be the amount that's applied, and then you would go back up and look at the 634. Because you go to the employee only, that's where we come up with our contribution for that. So that one person who is as a spouse in the division of which you work, you've already got your contribution from the school division at 826. Because your spouse works, we use an employee only. And we take whatever that contribution would be for employee only, and we add it to that number, okay? And then, once we have that number, we subtract it from that 1464, and then that's going to get your premium for that. So that is how we do the duals. Same thing with family, same principle. What is added for family is the contribution, plus what is added for the single, comes together, adds together, subtracted from the whole premium, and then that would be how a dual family or dual spouse works.
All right.
And which is zero, which I think we should have had those figures in the.
But I think,
column.
when I do the math in my head after Mr. Smith explained it, Aetna is still a little bit less expensive than Anthem. So I couldn't figure out why, so thank you very much,
Yeah,
Mr. Smith.
that's good.
Buck, I noticed here, we have 29 employees who have a spouse working for us, so it's,
Right.
yeah.
What other questions on this particular sheet, these two sheets? Okay. All right. The next thing I'd like to dive into is some input that we received back from our staff. From our last meeting, we talked about trying to figure out with Aetna. We know that Mr. White was earlier and looking at basically what overlaps from the Aetna plan over into the Anthem plan and vice versa, about 97% coverage. Now, we know numbers are numbers. I can average out anything and make something look different than what it is. If it's my team out there, I can make an 0-10 team look like about 5-5 real quick off averages, but the reality is it's 0-10. So we want to look at what is reality and those types of things. And this was an interesting survey we put out to our staff, just those who participated in our plans and those who were either a spouse or a family member who actually worked for the school division, who's on the subscribers plan. For those guys and gals to be able to look to see if their providers are covered by Aetna. And our question simply was on that is that basically are your providers covered by Aetna? Yes, then you just hit submit. No, then identify how many of your providers may be out of what you identify as network. Okay? And there seemed to be a lot of confusion around dental and vision. And here momentarily I'm going to bring up Mr. White to kind of talk a little bit about dental and vision. Roughly, and I'm going to break all this down for you, roughly those who respond, it's about 510 or so people who are on the plan, and about 260 replied to the survey. And that out of all of those, on the initial sending in the results, about 81% said yes, everything is in-house, it's in network, the whole 9 yards. So then I started to wonder, why would that 19% say that it's not? When I know just in myself and Maria Bolton, our benefit specialist, and several other people in our office, we've had people send in emails to us saying, please check this, please check that, and we've been doing that, and each time we're doing that, we're finding, yes, you're in network. We sent out a provider tool. It's actually kind of neat. You click on a link that we set up for our employees. You go in, you identify the plan that we would have, and then you identify where your doctors are at, whether it be Charlottesville or Front Royal or anywhere. And then you type in your doctor's name, you just hit the button, and it will show whether you're in network or not. And that most of the people, of those 19%, which represented about 49 people, over half of them had just one out of network. And I'm almost convinced that most of those that we dealt with were either dental or vision, assuming that they were out of network. I have yet, and I'm not saying they're not out there, but I had a meeting this afternoon with Ms. Bolton as well, who's been working on this, and we have yet to come across someone that we've worked with where their physician was not in network. Most of these came down to, they went to a particular practice, and they were confused of whether the practice says, yes, we cover, but they were looking for their doctor, and they were confused and said, well, I can't see my doctor, so I must be out of network and those type of things. But we've worked with a lot of those people. So 55%, so almost 26 of those people said they were just one out of network. Roughly 22% or 11 of those people said that two things were out of network. And we're able on our survey to be able to collect emails. We set it up this way so that in this particular way, I can respond back to those people. When I get a comment, I can respond back to those people saying, will you please identify for me if you'd like for me to assist you of searching for your doctor's office or something, or even making a call or whatever just to find out. We did that. There was 4 who said that 3 of their providers were out, and 8 who said 3 or more were out. And some of those down there, I almost find it impossible to have that many out of the network that large. I really do. So I know that of all the people that we reached out to, every one of them that worked with us, their physicians were in network. I can't verify those people who did not reach out to us or respond back to us, or I can't verify for those people who did not respond to the survey. But I feel much better about those numbers once we went through the process of facilitating with employees to help them through that process. Honestly, this is not something, this being insurance, this being almost financial planning and those type of things. I mean, I've taught for years, and it's not something you necessarily think about when you're in the classroom. Your focus more is on the children and your classes and what to do to get one child from one place to the next and those type of things. So some of this stuff, especially at this time, just can be overwhelming to be able to say, and a lot of our people, too, are probably still on their, I know they are their parents' insurance and those type of things, who are not in our program, but some who just recently left their parents' program come to us. It's kind of like, it's an orientation, it's kind of an indoctrination of what all this is about. Because I know at a much younger age, I did not understand all this. So some of that response I did not get back. I kind of chalk it up to they've either already looked at it, or it's just something that they feel comfortable with the direction, whichever direction that we go. I'm going to bring up Ed White from McGriff Insurance to discuss a little bit about that dental and vision, how that works, because that seems to be the most confusing for our staff. So, Mr. White, if you come up, please.
Good to see you all again. It's only been a week.
Yeah. Welcome back.
Thank you. So yeah, and again, thanks to Mr. Smith and Maria. They've been doing yeoman's work kind of navigating the survey and answering questions related to the survey. And I don't know, when we kind of established the survey, we were thinking medical doctors, and that was our geared path. And everyone started looking at dental and things like that. So let me give you a little bit of background. I'll do the real easy one first, which is the vision piece. So today, Anthem Blue Cross Blue Shield, they don't have their own vision network. They put all the resources in their medical network and their hospital network, which we know now is okay. When it comes to the vision piece, they actually use an outside company called iMed. So they hire iMed. iMed goes out and gets all the vision providers to participate, or some to participate, of course. And that is the network that Anthem uses. They kind of rebranded and they call it Blue View, but it is the iMed network of vision providers. By chance, it's the same company that Aetna uses when they go out and when they hire a outside vision provider to provide a network. So the network for the vision piece is the exact same network that folks are using today, the same iMed network. Okay, so if there's folks that are confused, they may be saying to their eye care provider, do you participate with Aetna? And that's okay. They'll get a new ID card that'll say iMed on it, and they'll understand it's the same network. And the vision providers will understand, oh, this is the same network I'm already with Anthem. So those folks were thinking, if they're confused, it might just be because they're thinking Aetna, and they're asking their optometrist, do you participate with Aetna? And that optometrist doesn't know Aetna uses iMed. Okay. Hopefully we're used to that, and that's kind of the way the industry works. Health insurance carriers typically don't set up their own dental vision networks. On the dental side, and this is true, I'll say when Bonnie and I, and this is Bonnie Lee back in the back corner, she works with me at McGriff, when we help groups navigate the dental side of the world, it's definitely different than medical. There is no great dental networks in the Shenandoah Valley. By that I mean, when we're talking about 90% or 95% of the doctors participating with Aetna on the medical side, you get over the dental side, and Delta Dental has the best network, but they probably only have about 50% of the dentists in their network. It's not substantial, it's not huge. Delta Dental is the provider that you all have today. So Anthem's the medical insurer. Delta Dental, even though it's different, it is the dental insurer that you guys use. That's the network that the local choice uses, is Delta Dental. So what we know today is that Delta Dental, probably half your employees aren't going to Delta Dental's dentists. They're probably going out of network, and that's okay. There's no real penalty for going out of network with Delta Dental. With Aetna, it's the same structure. So it's not Delta Dental's network, it's Aetna's dental network. But what we tell folks, and this is true of pretty any dental policy we sell in the Valley, if your dentist doesn't participate with Aetna, that's okay. Don't switch dentists. If you love that dentist, keep going to that dentist. That dentist, if they happen to participate with Aetna, just like with Delta, they'll accept the allowable charge. But if they don't participate with Aetna, that's okay. There's no out-of-network benefits. There's no 80-20 that goes down to 50-50 or something like that. Aetna's going to pay that non-participating dentist the same amount of money that they would have paid the in-network dentist. Okay? So folks sometimes, they're so programmed for health insurance, and I've got to go to my doctor, my doctor's got to be participating, that they think it carries over to dental, and it does not. So our communication to folks, if we go the Aetna path, would be great if you find your dentist, and some have for sure found the dentist on the Aetna list. But if they don't, please don't think you have to leave your dentist. My dentist doesn't participate with the carrier that I have. They'll file the claim for me and then get reimbursed from the dental carrier that I have, and just tell me, hey, you owe something or you don't owe anything. Okay. One other nice perk about the Aetna plan, the Aetna dental plan, and we covered this a little bit last week when we were talking, and again, I'm back to the sheets we were using last week. The allowable fee structure that Aetna uses for their dentists is much higher than Delta. Okay, so if I go back to that example, let's say you've got Delta Dental today with the local choices, who it is, and you don't go to one of those 50% of the dentists that participate, so you're out of network. Again, Delta's not going to penalize you, but their fee structure, their allowable charges are much lower than the industry standard. In Aetna's world, if you go to a non-participating Aetna dentist, their fee structure is much higher. So let's say the dentist charges $180 for cleanings and x-rays or something like that. Good chance that Delta, that non-participating dentist with Delta's going to approve probably somewhere around 130. Aetna's probably very close to that 180. So again, in both cases, the person's going to owe the balance bill. We know with Aetna, the balance bill is going to be much smaller because Aetna's allowable charges are much, much higher. Okay? way into the weeds, but the long and the short of it is, again, what we would tell employees is, if you really don't care and you don't have a dentist today and you want to find one, sure, go to Aetna, go to Aetna's directory. We can help you find a dentist that participates with Aetna. If you have a dentist you like today and they happen not to participate with Aetna, that's okay. Go to that dentist. Not going to change the way that dentist gets paid. Okay. Does that kind of make some sense? So in our survey, we were so focused on medical, I think folks got down the path of looking at vision and looking at dental, and we really didn't kind of cover that piece. We certainly will cover it in communication with the employees if this move is made. One other piece I wanted to make sure I mentioned as Buck was kind of going through the network, and we kind of were following up, making sure dentists or doctors were participating as we worked our way through the listing. I mentioned last week, Valley Health has Aetna. So we know there's a lot of people that already carry Aetna cards. This is not going to be a new card doctors are going to see. We know Shenandoah County schools and Shenandoah County employees are going to be carrying Aetna cards January 1st as well. So they're a month ahead of you all. If there's a doctor that doesn't participate with Aetna, or a chiropractor or a counselor, they're going to be saying goodbye potentially to a lot of business. We know there's not many, but if there is one or two or three in there, they're going to be not seeing a lot of patients potentially that would otherwise go to see them, especially with all this new business that's going to Aetna in the Valley. Okay. Any questions on that? All right. I'm going to hand it over, but when we talked last week, I mentioned the retirees was the one area that I guess I've spent the most energy on, at least trying to make sure I've thought through a place for those folks. I'm talking about the post-65 retirees, those that are on Medicare eligible. We know with the local choice, if we leave them on the group plan, that Medicare supplement also goes away, and we've really been not concerned, but we really want to make sure we had a place for the retirees. We talked about putting them on an Aetna plan and kind of saying, here's the only plan we've got, but we also talked about more hand-holding, having more face-to-face communication with those folks, and really helping them navigate, maybe this plan isn't the best plan for you. Maybe it is a totally different plan. Maybe you don't need dental, or maybe you don't need vision. So that's what we talked about last week, was possibly having a company from Winchester called Creekside come in and kind of navigate, helping one-on-one those 32 retirees, that's how many we're talking about, navigate their options beginning February 1st. So with that, I'm going to bring Jim DePruler up from Creekside Insurance Services and let him talk a little bit about his background. Some of you may know him, or some of you may know Creekside and our plans on that.
Thank you. As Ed mentioned, our office is in Winchester, Creekside Insurance Advisors. We already see a lot of your retirees now. We have about 11,000 individual clients through our office, most of which are retirees. So we also have 6 agents, 4 of which are dedicated to Medicare clients. So we know that market and we do a good job at it. We're licensed with practically every company that's in the Medicare market. One of the most important things for the retirees to understand is that no matter which way they decide to go, whether it's a Medicare Advantage plan or a Medicare Supplement plan, which are 2 completely different things, they are going to have guaranteed issue options on both sides of that. So there won't be a single person, a single retiree that's left having to go through medical underwriting to get coverage. Okay, so that's the most important thing there. It's very much, as Ed said, in the weeds when we start talking about the options with each individual or each couple, because if you were born prior to January 1st of this year, the guaranteed issue option is only Plan F with all companies except for Anthem. And if you were born after January 1st of this year and you're on Medicare, the only guaranteed issue option is Plan G supplemental policy. Plan G is practically identical to the Advantage 65 plan that the retirees have now, except Plan G does not require the retiree to pay a $100 hospital deductible, where your current Advantage 65 plan does have that. Meaning that Plan G is actually a little bit better, but most similar to the Advantage 65 plan. Also, Anthem Blue Cross has a standalone dental and vision package called Extra Packages that is purely optional, but it can be included as part of someone's options that they choose, and that also is guaranteed issue. no medical underwriting or no dental underwriting, and it's, you know, a pretty affordable option. And if they're used to using an Anthem, as Ed said, a Blue 200 network, and their dentist is in that network, it may be a good fit. But it will be an optional thing that we offer. The Medicare Advantage options that you see, has anyone seen any ads within the last couple of months on that? Obviously you have, Joe Namath and others. Those plans are as low as 0 premium. The plan in Warren County, if the retiree is a Warren County resident, a $19 plan from United Healthcare. We can pivot with each individual retiree as to what that retiree wants. It doesn't have to be a one-size-fits-all. And I think that's one of the good things that can be expressed to some of the retirees is that, hey, you can go this direction, you can go that direction. We're completely agnostic to that decision. We don't care which way you go, but what we're going to do is we're going to make sure you completely understand both this option and that option to make sure you make the best decision for yourself. Okay. But again, the big takeaway here, none of the retirees will have to go through medical underwriting. They will have guaranteed issue options on both the Advantage and the Medicare Supplement side of that equation. Okay? Any questions about the retirees? Anything specifically? If there's anything specific or personal, I can also be available after the meeting too.
Thank you very much.
Okay, thank you.
That it? Done, Mr. Smith?
Perhaps actually Jim could mention what, as far as with the retirees, yeah, you made that mistake to bring me back up. Perhaps
It's never a mistake.
No, I'm with you. Just briefly, just explain Creekside as far as with the customer service that you guys can provide with our current retirees, the over 65, to be able, once we start, if we go in this direction and we start contacting them and those type of things, what type of things are going to occur when, are you able to how does your customer service work when we say we have someone that's going to be contacting you and, just some educational meeting?
Are you speaking specifically about this group being able to be transitioned?
Yes,
okay.
Correct.
So as this group is transitioned into the individual Medicare marketplace, we can do this a couple different ways. We could dedicate 2 days and say, okay, Monday the 10th, Tuesday the 11th, whatever it is, are the 2 days, and we have 6 Medicare licensed and appointed representatives ready to go. So we could put 32 people on the docket within 2 days if we wanted to just kind of cram it into a couple days. I think, though, probably giving your retirees a little bit of flexibility would be the best way to go. And so that would just mean here's someone to call or to contact, and we have a receptionist at the office. Anybody there can put you on the schedule at your convenience. Maybe Fridays work better for you instead of Mondays or Tuesdays. Maybe 9 in the morning is better than 3 in the afternoon. So that would probably be the easiest thing, is just to provide the contact information and let the retiree make a decision for themselves and give us a call. Okay. Is that it?
Thank you very much.
If you have any other questions, concerning everything that we've covered, all of our sheets, I mean, we have myself, Mr. Smith, Mr. White here to answer those questions.
Anybody got any concerns, questions? I mean, everything I've had, they've answered everything I need.
I'm fine with everything.
Ralph, you good?
I completely understand.
Tell that ride home, you go, oh, man, I should have asked that question. Will of the board.
I like the other plan. I like the 1.3 million savings, the 20-month lock-in.
Yeah, I agree with that.
I think it's such a big thing, the healthcare coverage and that kind of thing. It's a very rare opportunity to take the system maybe in a little bit different direction, but probably not. Most people aren't going to understand, or not that they don't understand. I don't think they'll see a difference in how, they may get a letter from a different company and that kind of thing. I don't think they're going to see a change. Definitely, I don't think they'll see a change in a negative way in their insurance coverage, and how their claims are handled, and that kind of thing. And like I say, I think it's one of those rare opportunities that we have to stabilize our budgetary output for the next year at least, and for the 20 months of this contract. So I would be in favor of moving that.
I'm in favor for those reasons as well, and it sounds like everybody's hopefully going to be covered with their current positions, which of course is the biggest concern, because we're not sure.
Yes.
I think everything was well covered. There are a few gray areas here and there, but that'll get figured out. I like the idea of the 20-month with no increase for 20 months. That gives us extra space for planning our budgets. Whereas before it was always kind of up in the air. Well, we're waiting on the costs for the insurance. And so I like that part of it very well. The coverage seems to be the same. So I'm in favor of it.
When you read over all of it, I mean, insurance is very confusing, I think, to most people, and Mr. Smith said it best. Some of our teachers are on their parents' insurance. That's why they didn't respond. It didn't affect them. So, I mean, if I was on my parents' insurance and I got that, I wouldn't say anything, because it's not going to affect me today or tomorrow or next week. The cost savings to the school system is very significant. The cost to our employees is going to stay pretty much the same, the way I understand it. It looks like to me we're going to get a little better coverage in some instances. And I pulled my insurance card out because Mr. White said something about Delta Dental. And I know when I go to my dentist, he accepts it, and he charges me $25. And I said, what if they don't, what if it's more? Doesn't matter. So they've done their homework, and they know what they're going to get reimbursed for that cleaning you're talking about. So they know the 25 plus their reimbursement covers them. You say that Delta Dental or Aetna uses something like that. So probably most dentists in our area will be in that same category, and it'll be okay. I imagine we will have a few doctors that don't use it, Jim. I don't know. I mean, but it sounds like Buck's reached out, and most of them do. Doesn't everybody at Valley Health carry an Aetna card? So I would think they would pretty much have everybody in-house would use that. I think it's a win for the 20 months. It's huge for Mr. Valentine this coming year, trying to put numbers together. It'll be the first time he won't get a few more gray hairs. So, at least you got hair, Rob. A little. Looks like a lot to me. So I think it's in the right direction for our teachers and for the school itself. Anybody like to make a motion?
Mr. Chairman, I would, make a motion that we switch to Aetna on February 1st, 2021. It maintains the current employee contribution rates, but will hold all employees harmless from a rate increase. Subscribers electing the current preventive dental plan will have to move to a plan with comprehensive dental at a slightly greater cost than currently paying for the preventive plan. I move that effective January 31st, 2021, Warren County Public Schools terminates its agreement with the local choice for health insurance coverage, and that effective February 1st, 2021, Warren County Public Schools enters into a contract with Aetna Incorporated for health insurance. I further move that the proposed adjusted contribution rates for the remainder of the planned year be approved as presented. I finally move that the superintendent be authorized to sign a contract with Aetna Incorporated for health insurance coverage with an effective date of February 1st, 2021, and a term of 20 months, provided the contract reflect the rates, terms, and conditions provided in the Warren County Public Schools request for proposal and Aetna's proposal.
Second?
Mr. Valentine, can we do a roll call, please?
Mr. Chairman,
Aye.
Mrs. Bauer,
Aye.
Mr. Wells,
Aye.
Dr. Pence,
Aye.
Mr. Rinaldi.
Motion carries. Seeing nothing else on the agenda, I have one other comment. I would like to thank everybody that has worked on this diligently for us and covered a lot of time in a week's time. So thank you all very much. Meeting adjourned.